Zimbabwe's healthcare crisis. Hundreds of mothers and babies lost in January alone. Welcome to Zim Witness TV, your go-to source for the latest updates. If this is your first time here, please subscribe and turn on the notification bell so you never miss an update from our channel. Today I'm focusing in Zimbabwean health. It's so sad. The state of Zimbabwe's healthcare system continues to deteriorate, with devastating consequences for mothers and newborns. In January 2025 alone, nearly 300 babies and 54 women lost their lives due to childbirth complications, highlighting a critical crisis in maternal and neonatal care. These alarming statistics paint a grim picture of a system that is failing its most vulnerable citizens. The shocking figures were recently revealed in Parliament by Deputy Minister of Health and Childcare, Slimane Kwidini, who confirmed the extent of the tragedy. According to his report, Harare suffered the highest number of neonatal deaths, recording 111 infant fatalities, while 19 women lost their lives due to pregnancy-related complications. These numbers are more than just statistics. They represent lives lost, families shattered, and a national emergency that demands urgent attention. Why are so many mothers and babies dying? The root causes of these deaths stem from a combination of poor medical infrastructure, lack of adequate healthcare facilities, shortages of medical staff, and limited access to essential medicines. According to Kwidini, maternal deaths were primarily linked to surgical complications and pre-existing health conditions, which means many of these fatalities could have been prevented with better medical care. Zimbabwe's public healthcare system has long been plagued by underfunding, corruption, and poor service delivery, leaving many hospitals and clinics unequipped to handle emergency childbirth complications. Many expecting mothers, especially in rural areas, struggle to access quality prenatal care and are forced to give birth in poorly equipped clinics, or worse, at home, where the risks are significantly higher. Harare, the epicenter of the crisis. The capital city, Harare, recorded the highest number of neonatal deaths in January 2025. This raises concerns about hospital capacity, staffing shortages, and medical negligence. While Harare is home to some of the country's largest hospitals, such as Parirenyatwa Group of Hospitals and Harare Central Hospital, these institutions are overwhelmed by a growing population and a shrinking healthcare budget. Many pregnant women are forced to wait hours or even days before receiving medical attention, increasing the chances of complications such as prolonged labor, excessive bleeding, infections, and lack of oxygen for the baby. In many cases, by the time a mother receives medical assistance, it is too late to save her or the baby. A healthcare system in crisis. Zimbabwe's healthcare sector has been on a steady decline for years. Underpaid and overworked doctors and nurses frequently stage protests due to poor working conditions, lack of essential equipment, and unpaid salaries. In many hospitals, there are no incubators for premature babies, limited access to oxygen, and a shortage of basic medications, making it nearly impossible to handle emergency situations. This crisis is not just about numbers, it is about real people. Women who never make it home to their families, and newborns who never get to experience life. The situation has left many Zimbabweans questioning the government's commitment to improving healthcare and demanding urgent reforms to prevent more unnecessary deaths. What needs to be done? For Zimbabwe to reduce its maternal and neonatal mortality rates, the government must take immediate and decisive action, increase funding for healthcare facilities to improve infrastructure, equipment, and staffing. Ensure timely access to maternal health services by providing free or affordable prenatal care, especially in rural areas. Address the critical shortage of doctors, midwives, and nurses by offering better salaries and working conditions. Equip hospitals with essential supplies such as blood, oxygen, antibiotics, and surgical equipment to handle emergencies. Improve ambulance and transport services to ensure pregnant women can reach hospitals in time. A nation in mourning. As Zimbabweans come to terms with these heartbreaking numbers, many are left asking, how many more lives must be lost before real change happens? The loss of 300 babies and 54 mothers in just 1 month is a national tragedy that cannot be ignored. These were lives full of promise, dreams that will never be fulfilled. It is time for urgent intervention, accountability, and systemic change to ensure that no more families have to suffer such unimaginable loss. Thank you for watching this video till to the end. Please don't forget to subscribe, like, comment, and share.